Okay.
Alright, so I'm back in the med room and I went to go grab my morphine sulfate. And so I'm going to do my med checks here. So this is morphine sulfate. It's for Miss Llewellyn. So right drug, right patient. It's going to be 2 milligrams. So that's the right dose. It's the right route. So this is IV or IM. Today it's going to be IV. It's due PRN, and so when I asked her her pain level, it was a 9, and so that seems appropriate. And so that's our right reason as well, is her pain. And then we will be documenting afterwards.
That we need to use or avoid a specific arm blood pressure. So which arm is your dominant? You're right. Okay, so do we think we do
Okay,
next arm?
yep.
Yes.
And so I have this, which in the packaging it seems fine. It's not expired. She's not allergic to it. And then I'm gonna grab 2 flushes as well, and some alcohol prep pads. And we're gonna go back into the patient's room. Knock, knock, hand sanitize, provide privacy, 60-second assessment. I don't see anything. Hi, Llewellyn. So I'm right back. I just went and grabbed that other med. I hope this is running okay. Are you feeling okay?
Yep.
And your pain level, is that still at a 9?
Yes.
Okay, so this is going to help with that pain. I know I briefly touched on that, but I'll give you a little bit more information about this medicine. So this is going to be morphine, and this is just going to help with some more severe pain. So if your pain level was lower, we might have started with Tylenol, but because it's high, we're going to start with this. And this is just going to go in through your IV. We're going to push it. We're going to push it over 4 to 5 minutes because we don't want to give you too much all at once. And do you have any questions about that?
Nope.
No? We don't, we might have some like side effects. You might have some like constipation, so we'll keep an eye on that. You might feel a little like sleepy or woozy, and just let us know if you're having any of that. We'll keep an eye on that. So I'm going to do my second med check. Alright, so this is morphine. It's 2 milligrams, that seems right. It's for IV or IM, IV today. It's for now, it's for pain. And what is your name and date of birth?
Llewellyn, January 17th, XXXXX.
Okay, perfect. So we've got our rights and we will document afterwards. So, I've got all my stuff together. I'm gonna do my third check. So we got morphine sulfate, 2 milligrams, IV. It's for pain. It's due right now, and it's for Miss Llewellyn. Can you give me your name and date of birth?
Llewellyn, January 17th, XXXX.
Alright, so that's our 3 med checks. So we got our med all together. I'm gonna hand sanitize and put on some gloves. I just checked her IV, but I'm just looking again. Everything looks good. Line is running. Everything is looking okay. She's still feeling pretty good. I'm actually just going to now clamp.
I don't know. I really want to know.
Clamp her IV so that while we're doing this push, her line is not running. So that's all clamped, and I've got my 2 flushes, and I've got a couple of wipes, and I've got my med. And again, we discussed your allergies, but just to double check, just that sulfa drug allergy for you?
Yep.
Okay, perfect. Alright, so the first thing I'm going to do is I'm just going to scrub that hub for 20 seconds. And then we're going to just do a flush to make sure your line is clear. Okay, that's 20 seconds. Now we're going to wait for it to dry. And we're gonna flush, not too fast. Good. Alright, and then we're gonna do this med. For the sake of this video, I won't be pushing it over 4 to 5 minutes, but if I was administering to the patient, I would. And that's just so that we are not giving her the dose too quickly. And that's a major concern when it comes to IV push drugs. So I'm still scrubbing the hub 20 seconds, waiting for this to dry. And then we're gonna push the med. And again, I won't be pushing it over 5 minutes for this video, but I would. And I'm just gonna make sure, because unlike the saline flushes, the water does not just go up to the top. I'm gonna make sure I'm not getting any air. Okay, and that's all the way to the top. And then I'm going to connect this, and then like I said, pushing over 4 to 5 minutes. And then once more, I'm going to flush, and I would also push my second flush over the same rate as the med, because you don't want to shoot that med in if you're flushing. 20-second scrub, wait for it to dry. Again, I would naturally do it the same rate. And that looks all good. We see the med has gone through the line, and there was no resistance when I was pushing that. And now I'm going to unclamp my IV and let her have her potassium keep running. Alright, so I'm gonna then document both of those meds. Make sure she has her call light, which she does. Make sure she's comfortable. Are you comfortable, Llewellyn?
Yep.
Okay. And make sure that her bed is at the lowest setting. I'm going to then make sure I come back and check on her frequently to make sure that her pain level is going down and that she's not feeling any super negative effects of either of those drugs. Alright, so I'm gonna wash my hands, close the door, and head on out.